Hello, everybody. This is Dr. Kamel again, and a new content for the BT license exam preparation. If you didn't see any video for me before, my name is Dr. Kamel. I'm working as associate professor of physical therapy in the United States, and I am a registered licensed PT in several states, including Illinois, New York, Florida, New Jersey, and California, and in the UK and Egypt as well. So let's go to the content for today and see what is our question today is about. In addition to standard precautions, what other precautions should a physical therapist observe when working with a patient infected with methicillin resistant Staphylococcus aureus? We call this MRSA sometimes. And it is a type of infection which usually happen to patients who are admitted to hospitals as one of the complications actually, which should not happen, but it happens to some patients. So it is called MRSA, or methicillin resistant Staphylococcus aureus. Okay, so what other precautions, in addition to standard precautions or universal precautions, the physical therapist should do? Airborne, sterile, droplet, or contact precautions. Okay, so we have a standard precaution or universal precaution. We apply this to every patient, right? Airborne, sterile, droplet, and contact. We apply these precautions with different patients, as we will see together. So the correct answer is contact precautions, which is number 4. Okay. So methicillin resistant Staphylococcus aureus, Staphylococcus aureus is a gram-positive bacteria. And methicillin resistance means that this bacteria, in one way or another, developed some resistance to antibiotics. Okay, so it is a multi-drug resistant organism which does not respond to the normal antibiotics, commonly transmitted through direct or indirect contact with contaminated surfaces or infected persons. Okay, that's why I told you that some patients they might encounter this type of resistance when they are admitted to the hospital. Therefore, contact precautions are required in addition to standard precautions or universal precautions when treating patient with MRSA or methicillin resistant Staphylococcus aureus. So this is the correct answer. Okay. So, let's go through the types of precautions together and try to understand them. Standard precautions or universal precautions, this we apply to all patients, regardless of the type of infection or the organism they have, either bacteria, virus, fungus, whatever. And this involves hand hygiene, gloves, masks if there is a risk of splash. Okay. Next, contact precautions. Contact precautions could be direct or indirect contact with infectious material like MRSA, which is, our question today is about. Clostridium difficile. It is another type of bacteria, VRE and RSV, and herpes zoster. These are viruses. Gloves, gown, private room, or cohort, and dedicated equipment must be applied. Okay, these are the contact precautions. Droplet precautions, large respiratory droplets, which can travel in air less than 3 feet, and usually they will land on some surface, like influenza, like pertussis, like mumps. So, in addition to the above precautions. We should apply surgical mask within 3 feet. If you are close to the patient, within 3 feet. Patient wears mask during transport if the patient has to go outside the room for any investigation, MRI or whatever. We usually we limit the transfer of patient, but if the patient has to be transferred, then the patient has to wear a mask as well. Airborne precautions, it is a tiny droplet nuclei which remain suspended in air, and this is the main difference between droplet precaution and airborne precautions, as these tiny particles, they can travel and can be suspended in air, like TB, tuberculosis, measles, varicella, and usually we apply a certain type of mask which is called the N95 respirator, and try to keep the patient in negative pressure room in order to avoid spreading the infection outside the room. A sterile technique used for invasive procedures or surgery. So like in surgical operations, wound dressing, in a sterile field, and we have to use sterile gloves, gown, and the field should be sterile as well. Okay, so this is the main answer. But let's look at the incorrect answer. Um, so again, just to confirm, we said the correct answer is applying contact precautions in addition to the standard or universal precautions. MRSA or methicillin-resistant Staphylococcus aureus is spread by direct contact with infected wound or contaminated surface, and precaution should include wearing gloves and gown when entering the room, using dedicated or disinfected equipment, like the patient has to use stethoscope, gait belt, and so on for the same patient, so these are belonging to this patient. Performing hand hygiene before and after patient contact, keeping the patient in a private room or cohort with another MRSA patient. Okay. So since methicillin-resistant Staphylococcus aureus is spread by contact, wearing a face shield or mask is not necessary. Sterile precautions or techniques are not necessary as well for physical therapists to use with a patient infected with MRSA. Let's look now at the incorrect choices. Incorrect airborne precautions is incorrect because these, airborne precautions applied for infections with airborne particles like TB, measles, and varicella. Sterile precautions, again, this is in surgical or procedure, invasive procedure, dressing. Droplet precautions, the large respiratory droplets, which, as I told you, will travel within certain distance, usually less than 3 feet, like influenza and meningitis. And, MRSA will not do that. It is not a respiratory droplet. Okay. So, if you would like to join my course for the preparation of BT license, please drop me a message at these WhatsApp numbers, and I will reply to you as soon as I can with the details to join my course. And if you are also willing or planning about joining the post professional or the transitional DBT program at University of Montana, United States, which might have some discounted rates for certain nationalities. Please drop me a message also on WhatsApp numbers 001442248720 or 00201027743702, and I will reply you with the details, required documents, and how to apply. This cohort, which is a spring 2026 cohort, as a deadline for application and submission for all documents is November 26, which is this month. So time is approaching. So if you are applying, if you are planning to apply, please, contact me as soon as you can. Thank you for watching, and we'll see you soon in another content.